Okay, sounds good. Thank you, Daniel. Appreciate it. Welcome, everyone, and thank you for attending DCEO's West Central Virtual Job Fair. My name is Sal Garza, and I'm with the Illinois Department of Commerce and Economic Opportunity, and I serve as Regional Manager in the Office of Regional Economic Development for this area. We're delighted that you can join with some of our distinguished quality employers in the healthcare industry. When we're glad that we can help to promote the awareness of gainful opportunities that you may possibly be able to join their respective teams. Our state agency, DCEO, collaborated with the Center for Workforce Development at Southern Illinois University and Western Illinois Works, Inc. to host and coordinate today's event, which we are greatly appreciative for their outstanding technical assistance and ongoing support. We are hopeful that you can make the next positive connection in your career with one of the healthcare organizations that took the initiative to be here as you have. Let's listen to what the possibilities are, and I would encourage everyone to take that recommended next steps that you would hear from each of our presenters. Thank you.
Thank you, Saul. And first we have Mallory Owen with McDonough District Hospital. Mallory, are you able to present?
Yes, and unfortunately my camera doesn't work, so it'll just be a voice. So I am Mallory Owen from McDonough District Hospital. I am the recruiter, and I've been here about 2.5 years. So if you want to go to the next slide. MDH has been open since 1958 as a hospital. We are currently a 48-bed healthcare facility, and we are Joint Commission accredited. A few things that have been big news here at the hospital is recently, February of 2020, we have opened a new women's center, as you can see in the top picture. We have 3 brand new labor and delivery rooms, a 24-hour nursery, and 7 postpartum rooms. All those rooms have, almost state-of-the-art equipment, and it's more like a hotel, less like a hospital room. They're very cozy, very nice to be in. Another thing that we have recently opened is our permanent drive-through. It started just with our COVID testing, and now all of our lab can be done out there. So for instance, blood draws, COVID testing, flu vaccines, testing for strep, RSV, influenza. That's keeping us very busy. So we've had to permanently staff that facility also. So if you want to go to the next slide. This is just an overview of our mission, vision, and values. We have recently updated all of these. As you can see, our main points are basically our care to our patients, providing the best care possible and the best experience when they come to MDH. That's what we strive for. So you can go ahead and click the next screen. This is just a list of all the services offered here at MDH. I would say the main ones here are, our OB department is very a big thing here and known for in Macomb. And with the new facility, it's been talked about a lot. And then we have clinics that are staffed here behind the hospital with our ENT, our family clinics, just all the different clinics throughout. So you can go ahead and hit next. So some of our open positions that we're recruiting for currently and that we are in need most are RNs, full and part-time. As you can see below, we have acute care, which is like the med surge, ER department, home health, intensive care, OB, and surgery. Currently, our salary range starts at $26 an hour, and we do offer differential for nights and weekends. Environmental service and food service are new to the hospital. They were outsourced and they just came back in December. So this is my first time recruiting for them. But we are also in need of those positions, and those start at $12 an hour. And as you can see, there's also differential offered for nights and weekends for both those positions. Additional openings that are pretty new to our job list: groundskeeper. That position will be taking care of all the grounds, mowing, painting outside, mulch, anything you can think of. And then in the winter months, they will be inside painting and changing light bulbs and things like that. Office assistant is new to the openings, which is additional. Operator, which is our communications department, where they will take any calls and then transfer them throughout the hospital. Pharmacy tech, registration clerk, and then x-ray technician. The benefits here at the hospital: the company paid benefits. You have the basic life insurance, short and long-term disability, and a match up to 4% on your retirement. We also offer, which is new to the hospital, 3 plans of health insurance, dental, vision, and then we just switched over in February to a PTO bank. So that's been very exciting here at McDonough District. And then as you can see below, there's additional benefits that are offered voluntarily to the employee once they start. That's all I have. There's my contact information. Feel free to give me a call or apply online. If you have any other questions, we do have a human resources email that I didn't put on here. It's humanresources@mdh.org. If you have any questions about any of the postings, you can feel free to reach out to me.
Thank you so much, Mallory, for that presentation. If you do have any questions for our presenters, you may share them through the chat pod here in Zoom. So up next, we have OSF Healthcare, and I believe Matt and Shelley are on the line. Matt and Shelley, are you able to present? You may have to press *6 to unmute the phone. Matt and Shelley, are you able to unmute the phone to present? I think for time's sake, I think we can circle back to OSF Health. So in that case, Reagan Brown with Memorial Hospital, are you able to unmute yourself?
I sure am.
All right, let me pull up the slide for Memorial. Okay, so you can begin whenever you're ready, Reagan.
Yeah, my name is Reagan Brown. I'm the Chief Nursing Officer here at Memorial Hospital. And I will be just telling you a little bit about Memorial. We are an 18-bed critical access hospital located in Carthage, Illinois. We have 6 different clinic locations all around the county, and actually 1 into McDonough County. We have those in Carthage, Nauvoo, Hamilton, La Harpe, Bowen, and as I said, Colchester. In October of 2020, we celebrated 70 years of being around, and we also were designated this last year as a 5-star patient satisfaction hospital by CMS, so very exciting for us. We did open in 1950 and have been designated as a critical access hospital since the early 2000s. It is a locally owned hospital, but we do not get any income from local sales or property taxes. And we are currently the 2nd largest employer in Hancock County. Next slide, please. Here are the openings that we have currently. A Chief Human Resources Officer, the Director of Accounting, housekeeping aides, LPNs, maternal newborn RNs, medical assistants or LPNs for the clinic side, a surgery technician, a surgery RN, a med-surg RN, a respiratory therapist, clinic billers and coders, and then patient account specialist. And our website is listed below on the screen, so you can go there to visit and see any of our openings at any time. Next slide, please. So our services are listed, cardiopulmonary services, diagnostic imaging, diabetes, self-management training. We have dietary support, emergency and outpatient services. The Evergreen Center, which is actually a senior behavior outpatient center. We have family practice clinics, as I listed. We offer end-of-life services in the hospital. Next slide, please. Inpatient services, we obviously have a laboratory that runs 24/7. We do have OB as well as gynae services available. We have a 2-bed LDRP, and we have pediatrics, pulmonary rehab. We're able to do sleep studies here, obviously social services. We have lots of specialty docs, including cardiopulmonary, pulmonology, bariatric surgery, general surgery, urology, basically any specialty service, ENT, they all are here. We have speech therapy and then of course surgery. Next slide, please. The benefits are listed here. I won't go through each of those, but obviously competitive wages, depending on the positions that are available, health insurance, dental, vision, life insurance. We have some specialty insurances, including some cancer policies or short-term or long-term disabilities. We offer earn time, sick time. All you guys can read that, but tuition assistance and all sorts of things. So next slide, please. Melissa Meister-Brennan is our HR contact, and you can email her at hr@mhtlc.org, or you can call the hospital at 357-8500 and ask to talk to HR, and they can certainly help you with any questions or applications or anything that you need. I believe that's all.
All right, thank you so much for that, Reagan. Next, I think we'll try for Matt and Shelley. Are you able to unmute yourself? You should be able to now.
Yes, we're here. Good morning. My name is Matt, and this is Shelley, and we're going to present for OSF.
I'm Shelley. I am a professional recruiter here in Human Resources. I have been here for over 25 years in various roles. We will just give you just an overview of OSF, the mission and history. OSF was founded by the Sisters of the Third Order in Peoria in 1877. We have grown to be a very large employer. We have almost 24,000 mission partners, or we do call our employees mission partners, 147 locations, and that is including 14 hospitals. Our Western Illinois locations, we have OSF St. Mary Medical Center in Galesburg with 81 beds, OSF Holy Family Medical Center in Monmouth, and that is 23 beds as well. I will go over some of the non-clinical opportunities that we do have. We do have positions for food service workers. We also have the environmental services positions as well. Front office assistant positions for our OSF medical groups. This is more of a clerical position. We do have numerous openings for that. And Matt's going to speak on the patient access associate positions.
Yeah, so my name is Matt. I specialize in a lot of the clerical positions in the Western region. So patient access associate is one of those positions. Now, this position ensures that each registered patient has a complete and accurate OSF medical record, which includes patient demographics, insurance coverage, responsible guarantee and registration precision. This is a very customer service-based position. So while we like our mission partners to have some experience in healthcare, they don't necessarily have have to, as long as they have a lot of customer service experience, they would be qualified for this position. Patient access associates require a high school diploma or GED, 1 year in an office clerical setting or customer service environment, as I said, and working knowledge of standard and Microsoft applications and website navigation, just some technological experience there. This position does start off at $15 an hour.
We will go over some of the clinical opportunities that we do have. We do have clinical lab techs that we are needing, and this does require an associate's degree as the CLT. We also have medical office assistants. These positions are in our OSF medical groups. You do need high school education, minimum of 6 months healthcare experience, and this is rooming, charting, vitals. We do often find that our CNAs can move into the MOA positions, PCTs, patient care techs. This is also a CNA position that we are in need of the MOAs as well. Numerous clinical opportunities as a registered nurse. And we also, you do need your current RN licensure, AHA, BLS, CPR is required also. We do have over 1,700 positions available currently at OSF Healthcare, so actively recruiting for numerous positions.
Yes, so next slide, please. So I'll go over the benefits here at OSF. So as Shelley mentioned, at OSF, we don't call our employees employees, we call them mission partners because we want to make them feel like they are part of the mission, because they are part of that mission, which is to serve people with the greatest love and care and a community that celebrates the gift of life. So part of the benefit of being a mission partner are the benefits that we offer here. So that would be comprehensive medical, 3 plans there, dental and prescription coverage. We also offer PTO and sick days, 401k with 100% match of first 5% salary, so there's some matching there. Tuition reimbursement of up to $3,500 per year. We also have OSF paid life and AD&D insurance, and service rewards and various other employee discounts are available here. So that's for the benefits. We do have a benefits package available as well for all candidates that we move through the hiring process. And then after that, we're going to talk about how to apply. So we have a really nice setup website, osfcareers.org. It's a great tool to utilize because you can cater to what you're looking for. When you go on there to search, you can search keywords and location in that search box. So if you're looking for a specific location, you can type that in. If you're looking for specific hours or shift, first, second, third, you can do that as well. You can even make that up to the mileage that you're willing to travel. So it's a really cool tool that you can use on there at osfcareers.org. So filter all of that when you do search. It'll help you stay organized and find what you're looking for more specifically. So tips on applying. So one thing that we ask is that you obviously, in addition to reviewing the job requirements, make sure that it's a position that you'd be interested in. And all that is listed in the position summary. It will go over all of the hours, like I said, and the shifts, and any specifics that go with the department needs in terms of that. But it'll also go through the job requirements as well. So when you do apply, make sure you include any relevant work history on there. So obviously the more experienced candidates will be favored, and they will be our top candidates. Salary offers are based on how many years of experience you do have in those particular areas. Make sure you do double check your spelling and grammar and punctuation when you do put in your resumes and application as well. And you can check that application status at that website, as I mentioned, osfcareers.org. Once you get there, all you have to do is type in your information, and you can check back in on that and let you know where you're at on that application status. It's an up-to-date process. And that's all that we had for you this morning.
Thank you so much, Matt and Shelley. And if you do have any questions for our presenters, please feel free to enter them into the chat, and we'll be sure to ask them during the Q&A portion of this morning's event. And so up next, we will have Kristen Doyle from Hancock Village. Kristen, are you able to present?
Yes, I am.
Excellent. So let me get here. All right, you can begin whenever you're ready.
Okay, so yeah, my name is Kristen Doyle and I'm the Director of Nursing.
You can
at
see where the knife
Hancock
is.
Village. You can go to the next slide, please. Just a little bit about us. We house about 65 residents. We have Hickory Grove Supportive Living and Maple Grove Memory Care. Hickory Grove is supportive living for aging adults that need extra help and more socialization. We have about 44 apartments, or we have 44 apartments. Maple Grove is for people living with Alzheimer's and other cognitive impairments. And we have 2 separate buildings, each with 10 studio apartments. We provide 24/7 care with a team of CNAs, nurses, food and nutrition, and a medical director. Next slide. So for the residents, if they're needing more support than Hickory Grove Memory Care, we have Maple Grove. We have a beautiful campus, and I would just invite anybody that's interested to come check out the campus and see it for yourself. Next slide. Our openings right now are actually for the CNA and universal workers, what we're looking for both our memory care building and our supportive living building. Next slide. Some benefits available. We have health insurance, life insurance, a retirement plan, holiday pay for specified holidays, shift pay differentials, earn time for vacation, sick time, and holidays. Next slide. And we are affiliated with Memorial Hospital, so you can also contact Melissa Meister-Brennan for this at hr@mhtlc.org.
All right, thank you very much, Kristen. And our last presenter for this morning will be Becky Myers with Illini Hospital. Becky, are you able to present?
Sure. I'm Becky Myers. I'm the HR business partner here at Illini Community Hospital. We're in Pittsfield, Illinois. Next slide. We're part of the Blessing Health System. We're a 25-bed critical access hospital, and we also have a 10-bed geriatric psych unit here in Pittsfield. The mission of the Blessing Health System is to provide, improve the health of our communities. Our job listings change all the time. You can apply at www.blessinghealth.org/careers. Right now we are looking, of course, for RNs. We have a groundskeeper position open, environmental services, but they change. It feels like sometimes daily. Some of the benefits that we provide, medical, dental, vision. We're soon to open an on-site childcare facility here in Pittsfield. We do paid time off, educational assistance program. We have a wellness program, and we also do the 5% matching for our retirement savings.
All right, thank you very much, Becky, for your presentation. And with that, again, if you do have any questions in the chat for our employer presenters, we'll be sure to ask them now as we will be transitioning into the Q&A session. Seeing no questions in the chat, I'm going to go ahead and ask my own. So up first, and this question will be for Mallory with McDonough District Hospital. About how long does your hiring process typically take from submitting an application to being hired?
I would say anywhere, from 3 to 4 weeks for those jobs that we're definitely trying to get applicants in for. Sometimes if, it's something, it could be a little bit longer if it's something pending that we're waiting on, or the applicant can't get in here for an interview. It could be up to 6 weeks, I would say.
Okay, excellent. And I'm going to go ahead and ask the same question for Matt and Shelley. How long does the hiring process typically take?
So we like to make sure that we take a look at all of our applicants within 4 days of them applying. Typically, it's not even 4 days because we have a lot of really good professional recruiters here. But as previously mentioned, yeah, the general process, including the onboarding process, usually takes about 2 to 3 weeks. What would you say, Shelley?
Yeah, I mean, from the first, from the submission of the application, and they get forwarded to managers, it could be a couple days there, like Matt mentioned, on, hiring, interviewing, hiring, onboarding, and then, your physical background check. I would say it's around 2 weeks, but if something is pending, it could take longer.
Mm-hmm.
All right, thank you for that. Reagan, the same question about how long does the hiring process typically take?
I would say from the time of application to the time of start would probably be 3 or 4 weeks as well, just as long as there's not any hiccups, but a normal process is probably averages 3 to 4 weeks.
Thank you. And Kristen with Hancock, are you able to answer that question as well?
Yeah, I would say the same. From the submission of the application to the first day, I would say about 3 to 4 weeks.
Excellent. And Becky with Illini, can you answer that question as well?
I would say the same. Ours would be 3 to 4 weeks. We do a 2-step interview process with a interview with the manager first and then a peer interview.
So thank you. And so our next question for our presenters here, do you have any options for working remotely? And this time we're going to start with Matt and Shelley.
So most of our positions are not remote. If they are remote positions, it will say so in the job description. I know that our contact center agent, which is a very customer service-based position, is very similar to patient access. They're moving to get some more remote positions and opening those up. But in general, most of our positions are actually in person.
Thank you, Matt. Reagan, are you able to answer that question?
Yeah, mine's going to be the same as Matt's. Most of the time they're in person. Sometimes some of like the billing and coding positions can be offsite, but again, that will be differentiated on the website.
So, thank you, Reagan. Kristen for Hancock, are there any options for working remotely?
No, for us, we're really looking for frontline staff to take care of residents, so it'd all be in person.
Okay, thank you. Becky for Illini?
We're the same way. If it would be a remote position, it would be posted as such, but most of our openings here in Pittsfield would be on site.
Thank you, Becky. And then we'll last for this, Mallory, are there any options for working remotely with McDonough?
Currently there are not, and again, if it was remote or had the option, it would be posted on the job posting.
Thank you. And so our next question here is, how are you handling COVID safety precautions? And we'll go ahead and start with Reagan from Memorial.
Thankfully, things have slowed down quite a bit in the state of Illinois, but we still have several precautions in place. Some of those for employees would include, making sure that if you have any symptoms, you obviously don't come to work and let your supervisor know. We still have masking policies in place. And then, of course, when you're providing patient care, there are certain requirements as far as PPE use. And depending on your job, kind of depends on how in close contact you are with ill patients. So obviously the closer contact you are, the more restrictions. And I could definitely answer those questions per job.
Excellent, thank you, Reagan. Kristen, for Hancock Village, how are you handling COVID?
Yeah, so again, we are affiliated with Memorial Hospital, so we're following a lot of the same steps they are. In addition, we're closely following IDPH's rules for long-term care. So we're screening residents daily, taking their temperature, their pulse ox, and asking them if they have symptoms, staff is screened when they come in, and we're following the testing guidelines. So right now our staff is being tested monthly.
Excellent, thank you. And Illini Hospital, how are you handling COVID safety precautions?
We're down to one entrance of the hospital to enter, and we are looking for some screeners, health surveillance screeners that ask the COVID questions at the door for any of our staff or patients that come in. And really it would just depend on what position that you were applying for, kind of what precautions that department would use.
Thank you, Becky. Mallory with McDonough. Are you able to answer that question as well?
Yes, with some of the restrictions being lifted, we no longer are doing temperature screenings at the doors, and we both have, or we now have both doors open, ER and our main entrance. We are requiring masks at all times, additional hand sanitizing stations, employees to monitor symptoms, and then additional PPE guidelines when caring for positive patients.
Excellent, thank you, Mallory. And Matt and Shelley, how are you handling COVID precautions at OSF?
So yeah, we're kind of the same way as everybody else. We're handling that by the guidelines from the CDC with, cleaning and mask guidelines as well. We do have health screeners at our hospital facilities as well, screening people with their temperatures and asking COVID questions in relation to that. Of course, PPE for our clinical workers as well. Shelley, do you have anything to add?
We did create, the health screener positions, and they are at every entrance of every hospital, at all our OSF medical groups as well. We have lifted some restrictions with the visitor guidelines, but I believe that is monitored as well, and definitely still masking and hand sanitizing stations as well.
Excellent, thank you for that. Our next question here. What type of background checks are performed? And for this question, we're going to start with Kristen in Hancock Village.
So our HR department handles all of that, but it's just a background check. You would have to contact our HR department to get more details on that. I'm sorry.
No worries at all. Thank you, Kristen. Illini Hospital, what type of background checks you perform?
We use the fingerprint background check for anybody that's not licensed through the Illinois Department of Public Health website. And then we use a separate process for licensed employees.
Thank you. And McDonough, Mallory, what type of background checks are performed?
We currently use universal backgrounds where they do local and national searches for the backgrounds. And then also we do the IDPH fingerprinting for CNAs and other positions like that.
Mallory. Matt and Shelley with OSF, are you able to answer that question as well?
Yes, we do the IDPH fingerprint background. And we also use the third-party vendor universal background screening for all our other positions.
Right, and Reagan, are you able to answer that question for a memorial?
Yes, we use the IDPH fingerprint background, and we also use a third-party vendor that does local and federal background checks.
Excellent, thank you. So our next question, this will start with Illini Hospital here. How can a candidate stand out and get an interview assuming they're qualified?
Well, we love when people are interested in, and after they've submitted their application, reach out to us and give us a call. That's kind of a tough question.
McDonough, Mallory, are you able to answer that question? How can a candidate stand out and get an interview assuming they are qualified?
Yes, typically, I believe, just the managers look for, and also HR, if they have the experience, if they've done anything else, volunteering, anything like that, where they're, using their own time to help. We also do have a questionnaire that is sent to the employee after they apply, and it comes directly to Human Resources, basically, so they can just explain why they're interested in the position. And that's always nice to look at too, what they're looking for.
Thank you, Mallory. Matt and Shelley, are you able to answer that question? I think you spoke a little bit to that in your presentation.
Yeah, I would say the biggest thing that we're looking for here, because we mentioned our mission statement, which means a lot to us. Like we said, we call our employees mission partners. So we really look for those mission values in our workers. So the greatest care and love and serving and being professional and serving in an environment to really get the best care for our patients. And that starts at the top and really trickles down. So that's really what we're looking for. Shelley, do you have anything to add to that?
Definitely, on their application, the experience that they list, a resume. We do look at, the years of experience and the desired salary that they're wanting. They will get moved forward to the manager if they do meet the qualifications of the position. So it is often in the hands of the manager. If they are selected as one of their top candidates, then they would be reached out for an interview.
Yes, it really depends on what the manager is looking for each position individually.
Mm-hmm.
Thank you. Reagan, are you able to answer that for Memorial?
Sure. I think ours is similar to others, but definitely make sure that you have your volunteer work there, and then your related experience is certainly helpful.
So thank you, Reagan. And Kristen, for Hancock, how can a candidate stand out and get an interview, assuming they are qualified?
Yeah, kind of like everyone else said, just having experience with geriatrics. And usually I'll call the applicants, and I'm looking for somebody that's really compassionate about helping older adults, and especially those with memory problems.
All right, thank you. Our next question for our presenters is, what are the normal hours worked in a week, and is there overtime pay provided? And we'll start with McDonough. Mallory, are you able to answer that?
Yes, so typically hours are anywhere from, did you say a week? Anywhere from 36 to 40 a week for our full-time positions, 24 for our part-time. There is overtime pay offered, anything over 40 in a week.
Thank you, Mallory.
Uh-huh.
Matt and Shelley for OSF, are you able to answer that question? Normal hours worked in a week and if overtime pay is provided?
Yeah, so we do offer, of course, for second and third shifts, full-time, part-time, PRN as needed. So, of course, full-time is based on department needs. So there is shift differential for those night shifts as well.
It just depends on the department's needs for overtime. We're so large that, other areas are, busier than, at others at times. So it would just depend on the department needs.
Thank you. Reagan with Memorial, are you able to answer that question as well?
Sure. Do you mind repeating that question once? I'm sorry.
Sure. What are the normal hours worked in a week, and is overtime pay provided?
So ours is going to be similar. 36 to 40 is our full-time FTE. Yes, overtime pay is provided at 40 and above. Some of our positions that are posted are actually part-time. So even if at Memorial, even if you're part-time, you don't hit the overtime pay until 40 hours.
Thank you, Reagan. For Hancock Village, Kristen, are you able to answer that question as well?
Yes, and ours would be the same. Our typical hours are 36 hours a week, working 3 12-hour shifts, and we pay overtime for anything over 40 hours.
Excellent, thank you. And Becky, are you able to answer that question as well for Illini?
It really depends on the position. We consider anybody over 32 hours a week full-time. Anything over 40 hours would be overtime, time and a half. We do a night shift differential and also a weekend differential.
All right, thank you. Our next question for employers here. Do you have any restrictions on tattoos, hair color, or piercings? And for this, we'll start with OSF.
So there are dress code guidelines that are listed on our website and with our employee manual. That's really all I can answer to as far as that. Shelley, do you have anything to add?
There's policies, on nail polish, hair color, but honestly, I couldn't speak to the exact policy. It is on our One OSF portal, but we do have guidelines. Yes.
Thank you. Memorial, Reagan, are you able to answer that?
Yes, we do have a policy on dress code. We are fairly lenient, except we don't allow facial piercings. You can have tattoos as long as they're appropriate, uncovered, and hair color, we do like to have a normal, natural hair color.
All right, thank you. And Kristen with Hancock?
Yeah, ours would be the same as Memorial Hospital.
Okay. And Becky with Illini.
We do have an appearance standard. Some of the things that come to my mind are we don't allow sweatpants, no t-shirts, like with sports logos or things like that, no flannel. Our different clinical areas do wear scrubs, and we do color. So each department has their own color of scrubs that they wear.
Excellent, thank you. And Mallory with McDonough, are you able to answer that question as well?
Yes, currently we do not allow any facial piercings. Ears is all that can be pierced. Hair color, we don't have anything on that. And then again, with the tattoos, nothing offensive or derogatory showing.
All right, thank you. And our next question here, we'll start with Memorial. Do you provide workplace accommodations for people with disabilities?
Yes, we do. I can't, it would be situational based, but yes, we do.
Thank you. And Kristen with Hancock Village, would that be about the same? Or?
It would be the same, yes.
Yeah, okay. Illini Hospital, do you provide workplace accommodations for people with disabilities?
We do, yes, and it would be on a case-by-case basis.
Thank you. And McDonough, Mallory, are you able to answer that question?
Yes, the same as the others, case by case basis.
Okay. And Matt and Shelley with OSF.
Yes, we're equal opportunity employer, and yes, those would go by a case-by-case basis as well.
Thank you. Let's see, our next question here is, and we'll start with Hancock Village. Could you speak a little bit about the different shifts? When does a night shift typically start or a day shift?
Yeah, so at Hickory Grove, our shifts, we have 2 shifts, 6 a.m. to 6:30 p.m. and 6 p.m. to 6:30 a.m. And that's for our CNA staff. And at Maple Grove, it's 8 a.m. to 8:30 p.m. and 8 p.m. to 8:30 a.m.
All right, thank you. Mallory, are you able to answer that question for McDonough?
Yes, it's mostly our nursing shifts are 7A to 7P or 7P to 7A. We occasionally have a mid shift 11A to 11P.
All right, thank you. And OSF, are you able to answer that question as well?
We do offer all shifts, first, second, third, just depending on the department. Some are 6 to 2:30, some are 7 to 3:30, some are 7A to 7P. The second shift typically is 3P to 11P, and then the third shift, 11P to 7 a.m. But just depending on, we do have a variety of departments. For instance, maybe environmental services is, 6 to 2:30, but then more your nursing staff would be 7 to 3:30 if it's an 8-hour shift.
Yeah, all of our hours for those positions, we're really good about listing those on our careers website, osfcareers.org. So they'd be listed there for any applicants that would want to apply.
All right, thank you. And Memorial, Reagan, can you answer that question as well?
Yeah, so ours is going to be based upon what job it is, and that'll be listed on the website. For nursing specific, our shifts run from 5:30 A to 6 P, and then 5:30 P to 6 A. But otherwise, you know, for other non-nursing positions, we have first, second, and third shifts as well.
All right, thank you very much. And with that, we will conclude the Q&A portion of this morning's event. And I did want to say that this webinar has been recorded and will be posted to Illinois WorkNet's YouTube channel and each of the employer booth pages for our presenters who've been on the call today. And I want to go ahead and share a few resources that we have covered quickly before we close out here. So for the website up here on the screen, this is Get Hired Illinois, and this can be reached by entering www.illinois.gov/gethired. I'm going to share that link here in the chat. And this site is a web portal that's been designed to connect workers with available job and career training opportunities across the state. And from this landing page here, you can see a few different buttons, and we'll just go over some of them here. So this job seekers click here button, this will take you to the Illinois Job Link website, and this provides a search of jobs that are available in Illinois for those who are seeking them. The virtual job fairs here button, that will take you to the Illinois WorkNet virtual job fair page. And this is where you can find the employer booths of our presenters this morning. You can learn more about the jobs that are available, how to apply, and upcoming events as well. And the final button we'll go over here is the online training opportunities page. And this is a page on Illinois WorkNet that provides information on training options that are available to you, from community colleges to WIA approved training programs, other public and private programs, and apprenticeship opportunities. And finally, back on the Get Hired page, below these buttons, job seekers may apply for unemployment insurance and access additional resources through this page. And all the pages and resources I've just showed you are free to use for job seekers and will be accessible through this website well beyond this morning's event. And with that, I will go ahead and turn it over to Saul for any concluding remarks. Saul?
Thank you, Daniel. We greatly appreciate the work that these organizations do in our communities, and we would encourage everyone to take the next steps in terms of reaching out and hopefully connecting, with the possibility of joining their teams. I also want to thank my colleague Lance Shoup for all of her hard work and support with today's event. And to everyone else, thank you for attending and enjoy your days. Thank you.
Thank you.